everybody. Welcome to our Medical Wonders Medicine Week. So in order to get shadowing hours and certificates, you must attend 2 or more calls this week. So if you guys want to take a picture of this, then that would be the best way. But you'll get 2 hours per call per medical professional, and all the Zoom attendance will be marked down, but getting hours is on you. And we will also record the meetings and post them on our YouTube. But in order to verify your attendance, you must submit a 5 to 6 sentence paragraph of what the calls are talked about on the Google Classroom. And if you didn't get the Google Classroom invite, they were sent through our email. But if you didn't get the invite, please email us at medical.wonders with 2 S's at gmail.com. And the paragraph must be 5 to 6 sentences in detail. And when submitting the assignment, please put your full name along with the paragraph. And once you submit that, you'll get a certificate with your hours and full name written. And you can list this on your resumes by saying, we learned about different career paths and professions, college plans, and how to get into your specific program. And we got advice from these professionals and students about study habits, MCATs, and other important exams. And if you attend all calls this week, you'll get a total of 10 hours worth of shadowing experience. So yes. So a little bit about our organization. We are a student-led organization, and we educate and advise students about our astounding medical procedures, careers, discoveries, and devices. We actually have 4 executive teams. There's researchers, editors, communicators, and graphic designers, and we have 50 tutors and 10 college overseers and 200 plus members. And we have 300 plus people involved, and we reach out to many nonprofits, and we have 4.3K followers on Instagram. So basically a medicine week that we do is every day this week, a medical professional or a student will go on Zoom with us for an hour presentation, and they'll introduce their studies, and we'll have a Q&A session. And to check out our panel board and like our full description of each doctor, visit us on @medical.wonders on Instagram, and it's going to be our most recent post. So this is where all our recordings are going to be uploaded, just in case you have to leave early or you missed a session this week, but it's just Medical Wonders on YouTube. And do we have any questions about how this is going to work? We can answer some in the chat, or you can unmute. Okay, so this is our Instagram. So if you want future opportunities, please follow us. And thank you so much. So now we're going to get into it. So if you want to share your screen.
You ready for me to take over now?
Yes.
All right. Hello, everybody. I'll be sharing my screen momentarily. I appreciate the opportunity to get to lecture this group, and I commend all of you for being part of a group that's going to allow you to be proactive in your future choice of career. I am here at a friend's request to present perhaps an option a lot of you have not thought of. I myself was a pre-medical student 25 years ago in Boston College, and for my 2 first years of college, I was dead set on my career path. I wanted to go into medicine, meaning I wanted to go to medical school. I had not, as perhaps many of you have not, ever considered other careers within the medical science, particularly dentistry. I am a dentist. I'm a periodontist, which is one of 2 dental surgical specialties. And for reasons that I'm going to hopefully explain to all of you, my choice was a much better career choice for me, given what I wanted, given how I like to live, how I like to work. So I'm going to talk a little bit about dentistry and how I feel it should be a career choice that might be a great choice for many of you. So let me go ahead and share my screen here. And Tian, can you confirm that you can see my screen?
Yes.
Okay. So I'm talking to all of you about dentistry and dentistry as a career. I am a periodontist. That's an old picture when I was younger and had less white hair. I'm part of a group of periodontists. We're all dental specialists, all periodontists practicing in South Florida and the West Palm Beach area. Let me start out by talking a little bit about dentistry. Dentistry as a profession has been around for a little bit over 150 years. Before that, it was a trade, not a profession, meaning there was no formal training in order to practice dentistry. Dentistry was practiced, as many of you may have heard, by barbers and blacksmiths for the first 100 or perhaps 1,000 years of its history. All dentistry was extraction of painful and infected dental teeth. Now, this was an important trade, badly needed. If you think about, the Middle Ages, even late after that, there were still carbohydrates, there were still cavities, decay, dental infections. In fact, when you look at data in England in the mid-16 and late 1600s, dental abscesses, which I misspelled in there, were the 5th leading cause of death. So you can imagine a life before antibiotics, before antiseptics, before dental anesthesia, a pretty miserable existence, pretty miserable way of dying from a really badly abscessed tooth. Unfortunately, probably the fix for these situations back then wasn't much better than the problem. There was no anesthetic, there were no antiseptics, there were no antibiotics. So teeth were extracted without anything but perhaps some whiskey to dull the pain by barbers and blacksmiths who never received any formal training, because there was no way to obtain formal training at that time. Dentistry as a profession started forming in France in the early 1700s. This gentleman with the great wig that you see there, Pierre Fauchard was his name. He's known as the father of dentistry, and he published in 1728 the first textbook on the science of dentistry, which at the time was very limited, particularly because, of course, the techniques weren't around, the tools were around. You can see the very rudimentary tools that they practiced with back then, and you can understand why perhaps almost evolutionarily we have this dental trauma or fear of the dentist. They were pretty barbaric back then. Some would argue that it still is. But for the first 100 years or so, the existence of dentistry, it was practiced without real understanding of the etiology of many dental diseases. Most, if not all, dental diseases are caused by bacteria, are as many systemic diseases. And back then, we did not understand this. The germ theory of disease was not around till the 1800s, and the first formal college trained dentists, which started in Baltimore, Maryland, didn't start till 1840. So there was a lot that was not known about dental disease. The science was behind, the tools were behind. So it really wasn't until the early and mid 20th century that dentistry as it exists today started to form. Now, many of you have had dental experience, I'm sure, let me go back. Starting in the early 20th century, 1900, certainly close to World War II, scientific developments and techniques and our knowledge and understanding of dental oral pathology allowed for our knowledge base to greatly expand with the expanse of just overall medical and scientific knowledge. And this has led to a point where today there's over 10 dental specialties. So just in a small area of our mouth, there's 10 different dental specialties that focus on that area. Here on the list on the left, you see some of the more common ones that people of your age have been exposed to. Of course, when we were children, most of us had a pediatric dentist. Many of us have seen orthodontists and perhaps oral surgeons if you had your wisdom teeth removed. Oral surgery is one of the two dental surgical specialties. The second one is periodontics. I am a periodontist. You see there at the end some of the other specialties. There are dental radiologists. They're actually maxillofacial radiologists. There are prosthodontists, endodontists that specialize in root canals. So the vast knowledge of that dental science has led, as in medicine, to the development of specialties that can better handle the amount of knowledge out there. Any questions so far? Okay, so as a periodontist, I am a specialist in the prevention, diagnosis, and treatment of gum disease, as well as in the replacement of lost teeth with dental implants. So it is primarily a surgical specialty. The vast majority of my work in my office is of surgical nature. We, as periodontists, we are specialists in tissue regeneration. There's a lot of things that we've discovered over the last 50 years that have really advanced. Just like tissue regeneration is at the forefront of medicine, tissue regeneration is the forefront of what we can offer to our patients in dental science. What it requires as far as periodontology training here in the US, I know most of you are in the US, so you're familiar with this, but you need a 4-college degree. Some schools accept 3 years of college only, as long as you fulfill your requirements. As a dentist, I also have a 4-year dental degree, a DMD or DDS. As a periodontist, I received a Master in Science following 3 years of additional specialty training. And then through board examination and board certification, I became a board certified periodontist. What I deal with in my day-to-day periodontal practice are patients with advanced or complex dental needs involving their gums or missing teeth. These are patients that are referred to me by a general dentist. So just like you were at one point, speaking to your age group, at one point probably referred to an orthodontist by your general dentist or by a pediatric dentist, I, as a dental specialist, have patients referred to me by their general dentist because they have advanced needs beyond the qualifications or the treatment capabilities of the general dentist. So they're sent to me as a specialist to treat. These are patients who have gum disease, that have gum recession. As you see in the upper right picture, that patient with gum recession in between teeth that leads to an unsightly appearance. People with bone loss, gum loss, missing teeth, or otherwise other gum or periodontal pathology. A little bit about my life as a periodontist and life in the periodontal practice. And this is where I think some soul searching, some thinking of many of us when you're young and we are caught by the romanticism of medicine, particularly if you're thinking, I'm going to be a medical surgeon. You know, the reality of medicine and medical surgery is it can take over your life. You know, my medical surgical colleagues, they're on call every weekend, every other weekend, very long days, long surgery days. That's a really tasking, and if you talk to medical surgeons, it's a lifestyle that can be really tasking, physically, mentally, very stressful. My my quality of life as a as a dental surgeon, I feel is perhaps far better than my medical surgical colleagues. Dentistry is more or less, 8 to 9 hour workday, 8 a.m. to 6 p.m. At 6 p.m. I can leave all my problems behind. I'm not going to get many emergency calls. I don't have to go to the hospital at 4 or 5 in the morning or at midnight. And it's pretty much a 5-day work week. A lot of dentists even choose to do it over 4 days only because of some of the physical drain that the 5-day week dentistry can place on your neck and back. Most of my day is spent doing either consults or mostly surgery. That's what attracted me to the specialty, was the surgical aspect, and of course follow from surgery. And you see here what in the pictures on the right, all gone to us by Google. This is not me nor my office. I don't have any pictures of me in my operating cubicle. These are outpatient procedures done in the dental office, sometimes under sedation, twilight sedation, or intravenous sedation, often using our surgical microscope. And the typical setup for dental surgery would look like what you see in the two bottom patients. So the one on the bottom right using a surgical microscope, which I do for microsurgery, and the one on the left being more traditional periodontal surgery or implant surgery. Oh, so before I get into what some might consider the gross pictures, a warning. I am a dental surgeon. That's what attracted me to the field. So as part of showing what I do on an everyday basis, I'm going to show you perhaps some would say gory dental surgical pictures. If you're not ready for that, now might be a time to turn your screen off. But I assume all of you wanting to go into medicine are okay with these. So I chose some of the less bloody things, but this is kind of what I do as a dental surgeon, as a periodontal surgeon. This is a patient that had a crown and bridge done, so all the little teeth that you see are teeth that have been shaved down for crowns and bridges. They're removed in this case. You don't see the temporaries, but they needed crown lengthening surgeries, a type of surgery that you do to expose more tooth so new crowns can be built on these teeth. So it involves flaps, flap elevation, osseous bone recontouring, sometimes adding bone, adding gum tissue, suturing. These are 2 or 3 hour surgical procedures done under local anesthetic and intravenous sedation often, and they are, by definition, outpatient procedures, not done in the hospital, but in a private office, a private surgical center. The bread and butter of what I do is removing teeth that are failing or have failed for whatever reason. This is a root canal that you see on the x-ray in the lower left. The root canal that had failed, that tooth was painful, was removed. When you remove a tooth, you take the socket, the extraction socket, which is the hole left by the tooth, and you add some bone graft material. Bone graft material are bone minerals derived from human cadaver bone. It's no longer bone, it's just the minerals that help form a scaffold or a matrix. So your body can regenerate that lost bone. It happens over a 3 to 4 month period of time. And then later, a dental implant is placed to replace that tooth. A dental implant, as you see, that's the white bright part on the lower right. It's a titanium fixture that replaces the root of the tooth. On top of that, the general dentist now will build a tooth. So this is the bulk of what I do. I would say about half the surgery that I do involves some sort of extraction or dental implant placement. The subsequent slides, you're going to see more surgical photos, all my own cases of what I do as a dental surgeon every day. This is another dental implant surgery. If you look at the x-ray on the upper left, you have a tooth that you see only half the tooth is left there, only the roots, the tooth is broken off, and there was a tooth that had been missing for a long time behind it. So the tooth that's broken down is removed, 2 implants are placed, along with a gum graft. I didn't show the pictures of the gum graft. We'll see other cases that involve gum grafting later on. But these are dental implants that replace a teeth. They're long lasting. They should last the patient their whole life. This technology was developed from orthopedic surgery. This is very similar to orthopedic procedures using titanium joints to replace joints that are no longer working. So it's the same technology between artificial hips and knees made out of titanium. That's what these basically prosthetic roots are made out of, to replace failing or failed teeth. This is a tooth that had been missing for a while, a different case. We now go in there, we elevate a flap, we place a dental implant. We now allow the dental implant to heal for approximately 2 months before the dentist puts a crown or a tooth on top of that dental implant. Any questions so far? Okay, I'll proceed. This is just more cases. As you can see, this is the implant with the crown on top of it. So when done properly, dental implants will look, feel, and function just like natural teeth. They're a very aesthetic way to replace missing teeth. This was a patient, not young, this was a patient probably in the early 40s who had lost a tooth to an infection, to a failed root canal. I replace it with the lost tooth with an implant, and then the general dentist does the porcelain, the ceramic work along with a lab technician, a ceramist, to replace the missing teeth. They look just like the teeth that were replaced. This is perhaps a situation that some of you can relate with. This was a young patient in her early 20s, and this is not an uncommon situation. These are congenitally missing teeth. It means that her adult teeth never developed. They never developed inside the bone. They never came out. She had finished So the congenitally missing teeth were replaced with dental implants, and then the crowns were done on top of that. So this is a young lady who had her natural smile replaced very nicely by dental implants. As you can see here, that when done properly, when done by a good ceramist, a good general dentist, a tooth can be replaced with a dental implant, and you don't even know which one the dental implant is. In this case, out of the 2 middle teeth, the one on the left side is a dental implant. The one on the right side, well, that's my left and right, is a regular tooth. So I did that implant, and I can't even tell, because the ceramist did such a great job, which one the fake tooth is. Another case of a young woman who had been unfortunately hit by a car. It was a hit and run accident 1 year before her wedding. So she came to me very, psychologically stressed that she had a wedding coming up and no front teeth. We were able, over several surgeries over the period of almost a year, to build out the lost bone, build out the lost gum. So this required multiple procedures, bone grafting, gum grafting, to replace the pink framework. That's what I do. I replace the framework and I place it 2 dental implants. On top of that, the general dentist did a beautiful job along with the laboratory technician in building two beautiful and lifelike and natural looking teeth to replace her missing teeth. And that was before her wedding, so she was very happy about that. Another thing, as I mentioned before, as periodontists, we are the specialists responsible for regenerative therapy, regenerating lost tissues. Very often that means regenerating lost gum that has been lost to recession. Recession is a natural process. It happens in all of us gradually. By the time we're in our 40s and 50s or 60s, most of us have one or multiple areas of recession. Sometimes it's due to wear and tear of the gums. Sometimes it's due to grinding. Sometimes it's due to overactive brushing before the invention of the electric brush. And lost gum can be regenerated or replaced through gum grafting procedures. Also, we do procedures to replace lost bone or to stimulate the body to regenerate lost bone. What I'm going to show you here is a soft tissue grafting procedure or a gum graft. This is what you see there on the upper left is the graft over the area that's being treated. That's this case that you see here. That's the graft that's placed over just to demonstrate the size of the graft. That graft was harvested from the patient's palate. So it is autologous in nature. This is what works best in these cases. And then it is sutured in place. I create a tunnel, and into that tunnel, the graft is placed and sutured over. These heal very beautifully. You see here before and after. We've regenerated lost tissues. We've thickened the tissues. We've reversed the recession and given the patient a more natural look, a more natural smile, and a healthier situation, healthier gum. This is another case before and after of gum grafting. You see the two side teeth on the upper left there had recession on them. This was before and after we grafted them. And another case, this is a young patient. He's in his early 20s, who after braces had some issues with recession because of the way teeth were moved, and we were able to fix that with a gum graft. We also often are called to regenerate lost bone. If you see here on the upper left photo, that's a tooth that has been missing for a long time. And when teeth are missing for a while, the bone underneath it, called the alveolar bone, will atrophy. Just like muscle that's not used atrophies. You know, you see astronauts in the space station who are on treadmills because otherwise their leg muscles will atrophy without gravity. Bone in our jaws will atrophy when there's no function on it. The function is placed by teeth or by dental implants. So when they've been missing for a long time, the bone atrophies, and it has to be grafted before we place an implant. So what you see there in the middle upper picture are some, we call them tenting screws or tenting pins, which support the bone graft. Mineralized bone graft is added. It's covered by a collagen membrane. That's what you see in the lower left, and then sutured and then left to heal there for approximately 6 months while the body. So again, I add the mineral matrix, the mineral scaffold on which the body now infiltrates that area with bone-forming cells, we call osteoprogenitor cells, and slowly starts turning over that bone graft and turning into your own bone. By the time I go in there to place the implant 6 months later, you see now, compare the little screws that you see here in the middle are now completely taken over or built over by the bone. There's all new bone that formed around them. And now I can place a dental implant to eventually replace your missing tooth. So if nothing else, you guys will all be flossing after today's presentation, hopefully. So this is another perhaps age-appropriate slide. There's a lot of young people your age and even older patients that have what we classify as a gummy smile. And this is because of a process where once the teeth finally erupt, and perhaps you've had braces, the gums are supposed to naturally settle around the neck of the tooth or around what we call the junction of the enamel and cementum. And sometimes for reasons we don't clearly understand, that doesn't happen, which means that the gums are still covering part of the teeth. So in a procedure known as aesthetic crown lengthening or a smile lift, we expose a part of the tooth that's being covered by the gums and the bone. So this is a procedure that involves, again, a flap, a surgical flap, so I can access the bone. That's what we see in the lower left side. And that bone and the gum are recontoured or trimmed away to expose the full natural tooth and natural smile. And it has really dramatic effects on someone's smile. And a gummy smile can be considered, not attractive. So we can expose all our natural teeth. And this is also a young woman who saw me before her wedding for this procedure. So That perhaps a little bit, no, that's right on time. I was asked for a 30-minute presentation and then a 20-minute Q&A. So that's just a sampling of some of the procedures that I do as a periodontist, as a dental surgeon. I get to do lots of different kinds of procedures, which is part of what I love about my profession and my surgical specialty. And something to consider as you go into medicine or dentistry is what excites you about the field of medicine, the field of the health sciences. Do you love research, which might lead you to a PhD in the research side of medicine and dentistry, which is very much needed, and kudos to people who do that. Are you more of a diagnostician, what I would classify as a detective? If you are, then you want to look at a medical specialty such as being an internist, where you look at exams, you try to figure out what the problems are with people. I find that part of dentistry or medicine terribly boring. If all I have to do is read charts, look at exams, look at labs, to try to figure out what the problem is. I'm a fixer, I'm a carpenter. So similar to an orthopedic surgeon, we don't have to go in there and put a tremendous amount of thought into what's wrong. It's pretty obvious in looking at a mouth what needs to be fixed. And allows me to go in there and fix it. That's what drives me. That's what's always driven me. So if you are a fixer, a tinkerer, a carpenter type, then not only is dentistry an ideal specialty for you within the medical specialties, but certainly surgical, the surgical subspecialties of dentistry are ideal because they're going to allow you to fulfill that fixer mentality. If you're a detective, if you like solving problems, solving mysteries, then you should be an internist or an oral pathologist or oral medicine specialist. But consider dentistry over medicine. I believe that it has the opportunity for a better quality of life. It still gives you the opportunity, we're all caretakers, that's why we like this field. It still gives you the opportunity to have a positive impact on your patient's health and your patient's smile. And it's perhaps because I had good experiences as a young adult and as a child with my dentist, with my orthodontist. I always held them in great esteem, and it's part of who I am today. I have patients that appreciate being taken care of. I have the opportunity to take good care of them, help them get their health back, and I have zero regrets of having chosen dentistry over medicine. It's definitely what I was meant for. So I'll open up the floor now to any questions that we may have. Yeah, I'm going to put you on the spot and have you start with a question.
Okay, so someone in the chat. Sorry?
I'm going to put you on the spot. I'm going to have you start with the first question.
Okay. I'm just going to read from the chat, but someone asked, I know you mentioned that you have always held a passion for surgery, which is why you choose periodontics, but was there a reason you felt a stronger inclination towards periodontics as opposed to oral surgery?
Yeah, I now see the chat. It had to do with exposure and what you're exposed to in dental school. In my dental school, the periodontic department didn't have the budget to hire dental assistants. So dental students were brought in as dental assistants. I got exposed to a lot of aspects of periodontics. I did not receive similar exposure in oral surgery. Oral surgery is equally as challenging, equally as fruitful, and equally as rewarding. If you see yourself in a hospital doing big fixes, fixing people's faces after trauma, reconstruction, broken jawbones, then oral surgery is a specialty for you. If you are more of a microsurgeon, like fixing small stuff, spending a great amount of time fixing a little thing, then periodontics is more specialty for you. Certainly, you have plenty of time to decide once you make the bigger decision of dentistry over medicine, because in dental school you go through many different rotations that'll give you exposure to all specialties. So thank you, Fatima. Okay. Other than the varying work-life balance, what do you believe sets dentistry and medicine apart? Well, I'm going to speak for what's going on here in the U.S., which is unfortunate. When you look at the quality of life and particularly the how happy perhaps clinicians are in the U.S. Something that is unfortunate for clinicians, fortunate for patients, is as medical insurance or insurance takes over the field of medicine. So now when you need a medical procedure, you always go through your insurance. That's not the same thing in dentistry. I'm going to explain a little bit more. So when you have insurance companies making decisions, it takes the clinician away from that. And it takes away from it creates a lot of bureaucracy, a lot of red tape. You're often forced into decisions that you don't think are the best for the patient, but that's what the insurance covers. That's what the insurance does. You get into situations where the insurance is paying you only half of what you were paid before for a certain procedure, and where you feel you have to do more procedures just to cover your costs, your overhead, in order to still take a paycheck at the end of the day. This is how we, it's a profession. We do primarily take care of people, but we all have rents to pay and mortgages to pay, so you need a paycheck at the end of the month. So the situation in the U.S. where insurance has taken over medicine, there's no doctor, the medical doctor you speak to, that can't tell you that's not a big part of their life, and unfortunately has detrimental to their work experience. In dentistry, only a smaller subset of the dental field is ruled by insurance. So I have a luxury as a dentist, as a dental practitioner, as a dental surgeon, to practice outside the scope of insurance. Meaning, you come to me with a patient as insurance, well, we will see if insurance will help you, but you have to pay for me, and I can charge for my time, I can charge for the way to do things, I can make decisions on my own without pressure from insurances. So insurance is not really in the picture. It's on the side, the patient gets some reimbursement from insurance. And I would say today in the United States, that is one of the biggest things that needs to be considered. And the role of insurance in healthcare and what it's doing to medicine, it's only going to get worse. And that's why you see medicine evolving in the United States. I'll tell you another thing that's really, really important, and every single one of you should be considering, is how are you going to pay for your education? The amount of debt that we see young students coming out in medicine and dentistry is completely, it's a mess. Unless you know exactly where the finance is going to come to pay for your education, do not get into this field. Unless you have great loans, which isn't the best way to do it, because you're going to graduate with a lot of debt. You have a family that's willing to help you out, or you're willing to commit, which I always encourage young students to look about doing, having the government pay for part of your education, then you give them by either working for the Army, Navy, or the Armed Forces, or Indian Services, or other, get as much of that help. Loans are not the solution, because loans come with great debt, and I routinely come up to students in their late 20s who are $300,000-$400,000 in debt on day one of their career, and you never get out of that. So I lost my point with regards to that. That's something that you really need to consider. I think I had another point, but I lost my words.
Someone asked, what was your favorite part about dental school, and when did you know you wanted to pursue dentistry rather than medicine?
Right. So you want to figure that out before dental school, right? Because I had a couple of classmates who hadn't figured that out and dropped out halfway through dental school. They still have to pay for those years they attended, and that's a very painful loan to pay when you're not even practicing dentistry. For me, it was, I thought I wanted to go to medicine, but I never really knew why. And when I thought what medicine was, most of medicine is more detective related, unless you go to one of the surgical specialties, and that really wasn't me. I was just on this path because I wanted to be a doctor, quote unquote, and my only idea of a doctor at that time was being a medical doctor. It was my sophomore year in college that a senior student at Boston College said, you should give dental school a thought. And right away, I thought of my experiences as a young adult, as a child in the dental chair, with my pediatric dentist, with my orthodontist. And these were all people that had very positive, that acted as positive role models, people that I esteemed professionally, people that got to play the doctor part. And the minute I thought about it, I never looked back. It made sense to me because of my experiences and because, dentistry still checked off the entire checklist of what I wanted to be. And it still allowed me to be a doctor, still practice in the health science, have a science-related career. And then within dental school, when I went into the surgical aspect, because it allowed me to tinker. I was a fixer. I didn't want to go into the detective specialties. And I knew I wanted to specialize. Doing general dentistry is not something that I would have been right for me. What was my favorite part about dental school? I know it's tough, it's stressful, it's long days, long hours, just like medical school. My favorite part of dental school was not in dental school. It's what happened when I was not in dental school. So I don't have any negative experiences in dental school, just that it was stressful, it was challenging, long days, long hours in the lab. It was all rewarding in its way, but I can't say I had a favorite part about it. I mean, gross anatomy is cool, cadaver dissection.
Someone asks, I know other branches within the medical field have a bit of flexibility with where they choose to practice, such as private practices, hospitals, academia, etc. Is the same concept applicable to dentistry?
Yes and no. You don't have as much flexibility. The vast majority of dentists go into private practice. That's changing in the US somewhat because just like insurance is going in and corrupting, if I may, medical medicine, corporate dentistry is coming over and taking over a lot of dentistry. Corporate dentistry are these massive dental corporations that own lots of dental offices, and it's what a lot of young dentists have to do because they can't start their own office because they're too much debt or they don't have the opportunity to start their own office. So there's some, of course, there's always opportunities in academia. That's most dentists choose to do that later in their career as they're slowing down, they're going to teaching. There's some which are the PhDs of dentistry, which go straight into research and academia. But you don't have the opportunity to practice in a hospital setting in most dental professions. There is special care dentistry and even dental anesthesiology, which you can practice in the hospital setting, but most dentists don't practice that. So vast majority in traditional dentistry is still private practice.
I have a question. So what are some qualities of a person that would thrive in this profession?
Quality. So I'm gonna just answer specific to my chosen specialty. Again, we're tinkerers, we're carpenters. We like to fix things. You need interpersonal skills. You know, if you don't have, and I think you need that for any field within. I remember the financial question. We'll go back to that in a second, but you need personal skills. If you don't like relating to people, or perhaps you can be brutally honest with yourself and say, do I have that gift? Do I have the gift to be able to relate to people and connect with people? If you don't, then look at research. Look at other fields within medicine. Unless you're a people person, in my opinion, this is just my opinion, you shouldn't be going into medicine and dentistry. You need, in order to be a good clinician, you need to be able to connect with your patients, you be able to communicate well with your patients. If you're an introvert, and this is where some real soul searching is needed, because many of you have already dedicated 3 to 4 years to your career pre-med. You know, if you're an introvert, if you have problems talking to other people, again, do some soul searching now and consider aspects within healthcare that don't require that. That is the biggest gift that we have as clinicians, is our ability to connect to patients, interact positively with patients, make them feel comfortable, establishing trust. That is the most rewarding and often sometimes the hardest things to do. And I went to school with many introverts who I know were never capable of that. And perhaps, I know some of them were not successful. And I think that's a big part of them. So that's where some soul searching needs to be done. I remember now my point with the finances. When you look at the changing nature of medicine in the United States, and a lot of you probably are already in a 4-year university college and have made that decision to go, medical or get your MD. I see tremendous opportunity in nursing and tremendous opportunity as a PA, as a physician assistant. These are career choices that perhaps don't have the esteem that being a medical doctor have, but they allow for tremendous flexibility. And that is where I see the medical profession in the US heading because of insurance. Because as a doctor, you have to see so many patients as a single doctor to cover your overhead to get paid that you can't. So I have monthly experiences with my physicians where I rather see the PA because they seem to have a little bit more time. Now the PA, they're not as much debt. They perhaps didn't have to go for school as long. They still get to practice most of medicine, and particularly if you look at some of the advanced degrees in nursing and physician assisting. And within nursing, I mean, I think it's equally as meritable a career choice. And whether you're male or female, traditionally more of a female role, but it shouldn't be that way. And I think that's changing. And I cannot think of any career choice that has as much flexibility as nursing, as many opportunities for great pay, for rewarding work. It's not all about being a nurse in a hospital. That's usually where you start. But from there, you can take it to many more places than just about any other health field.
Someone asked, what are some extracurriculars or experiences that you think are needed in order to have a successful dental school application?
So dental school is becoming more and more competitive. It's not nowhere near as competitive as medical school, just because you don't have the number of students applying that you have applying to medical school. But you rarely hear of students having to apply to international schools or the Caribbean, like I see routinely happening in medicine, because it's so competitive to get into U.S. medical school. So, you still have more opportunity to stand out as a dental applicant, but you still have to have the GPA, you still have to have the test score, you still have to have the shadowing experience. I think that's critical. Summer experiences that show those people reviewing your application that you did receive exposure. I worked at a dental school for a summer in Boston, and I got to interact with dental students. I got to work in the dispensary where I sterilized instruments with dental students. So I would think that was valuable in my application, because those people review and say, okay, this person knows what at least the dental student life is like. So I would encourage you, if you live in a town or a city that has a dental school, to see if next, let's say you're a sophomore or a junior, next summer you can work there and do as much shadowing as you can, so you know what you're getting into, and with as many different specialties as you can. Anybody, I will pass on to your board leader here. I'll pass on my email. I know Elena, who invited me to this, has it. But if anybody is in the South Florida area who wants to come shadow us in our office, me and my partner, you're more than welcome to.
Someone asks, are there any surgical procedures you prefer not to complete?
I think the right question is that I prefer not to engage in, right? If I start one, I'm going to need to complete it. And yes, there are certain procedures that I train that I do not routinely do, because comorbidity is associated. That comorbidity in medicine and dentistry has nothing to do with dying. I don't know why the word is used. Comorbidity means complications. There are some procedures that have a high complication rate. I don't like to do them. Here's another thing to think. If you see yourself as a medical surgeon, at one point early in your career, you need to do yourself that soul searching and say, am I capable of dealing with morbidity and death on a frequent basis? Am I willing to be responsible for not saving a patient's life or having a patient's life escape while I'm working on them? I can tell you, I am not. I would not have been able to, and this may be the most important thing I can share with you who are thinking going into medical surgery. If I had been an orthopedic surgeon, which is probably what I would have been had I gone into medicine, to think that when things go bad, people lose limbs, people are numb, people lose function, the liability associated, the lawsuits, I would not be able to handle that. When a day goes bad in my office, someone loses a tooth. And so that's much easier to handle. That's much less likely you're going to get sued of. Lawsuits in dentistry don't really exist if you're practicing responsible. Whereas in medicine, it's unfortunately become part of your daily life because of the litigious nature of our society. So yes, there are certain procedures that I prefer not to get involved with because of either the complication rates or because I don't do them on a day-to-day basis. I'm a big believer as a dental specialist, you have to be doing something that you do all the time to be proficient at it. And if you're not doing it all the time, don't do it at all. Send it to the colleague down the road who is doing it more frequently. So find out how you're going to pay for school. Figure out if you can deal with someone dying under your care while you're doing surgery on them. But this particularly goes to the surgical specialties, but also if you're managing the medication, you miss something. You know, I think you will practice in a different world where, you know, AI and artificial intelligence and software and computers are going to help us manage the diagnosis of patients more, and you're going to be less likely to make medical errors in prescriptions. But still, surgery, you know, the robots aren't taking over anytime soon. You have robotic assisted surgery, but there's still a person handling that. And you know, you're still able to make a missed movement and nick an artery and kill a patient during surgery. Can you live with yourself after that? I don't think I could. Or are you willing to have that part of you shut down, which is, I believe, what unfortunately a lot of medical surgeons have to do, is you have to shut that empathy off in order to deal with death on a daily basis. If you're in the ER and you see people die on a daily basis, can you really, you know, turn that empathy on and off and interact empathically with, which is what we owe our patients, interact empathically with the patients who are not dying on you. And the way I see it, no, most people can't. They have to become numb to that. So you become a number to them, and you're another patient that you're seeing, and the empathy gets turned off, because if it's on, most humans cannot deal with that day in, day out. You have to turn people. There's people who can't handle it and leave the field. People who can handle it only by turning off that side of their personality, and then you become a non-empathic caretaker, and that's sad.
I have another question. So how has dentistry changed over like the years, and do you see it changing in the future, like, in any way?
Yeah, of course. And so research and science and changing techniques, the change is happening much quicker in medicine because of the money in medicine, meaning the research money, the grant money, the research money. So I guess there is a much greater opportunity for knowledge growth in medicine because it's so all encompassing. Generally, we get the trickle down effect in dentistry, but a lot of dentistry just isn't that complicated. You know, in medicine, you're dealing with organs, you know, complex organs, the heart, the liver, the brain, the nervous system. Whereas dentistry is more, you know, tinkering, it's carpentry. So it's just not as complex. So you don't see the degree of advancement that you see in medicine, but or the increase in knowledge base. But yeah, I mean, it's changed dramatically even in my lifetime. I mean, what we can do in healing times, in modalities, and, you know, use of growth factors and regeneration. So where is dentistry going? I'd love to see eventually robotics get involved in dental, and they are already. So just like you see the big robots where you have robot-assisted surgery in medicine, you're already seeing that in dentistry. It's difficult because of the money's involved. Those are very expensive tools that usually hospitals can buy. A private dental practitioner cannot afford to buy a robot. They're very expensive. So robotics and regenerative therapies. Eventually, what we'd like to do is be able to, rather than put an implant to replace a tooth, you know, perhaps certainly in patients that are born without some teeth, adult teeth, to be able to implant a tooth bud that will allow that natural tooth to grow. So that's the ultimate goal of regenerative dentistry, is to regenerate lost teeth or lost tissues. So we're getting better at that. All right, we have another question here from Fatima. All right, second question from Fatima. Thank you. So Canadian, you have Can everybody in the group, yeah, you all have access to the chat, so you can read Fatima's question. I'll read it out loud. She's Canadian, and they do have health insurance. The Canadian system is different than the American system in that the social medicine aspect is much stronger, and this is government paid medical insurance, which doesn't exist or doesn't yet exist to that level in the U.S. BS politics. But what, believe it, are the steps needed to make medical care available to all U.S. citizens? Ooh, okay, that's a political and that's a global economic question, bigger than me. Well, I hope it happens. I mean, I think, you know, medical care is a human right. So the fact that it's been politicized is disgusting to me. What needs to exist, however, is what exists in Canada is a dual system where you have a strong and well-funded social medicine system for the vast majority of people who cannot afford it. And then for those who can, you still need a strong private system. So those of us who can or are willing, who give value to our teeth, who are willing to invest into our mouths and our teeth, or medically can say, okay, this is what the social system takes care of, which is the basics, and, you know, make sure I'm not going to die from tooth abscess that I get to have teeth. But if I want more advanced, I'm willing to pay for it. I'm willing to make that sacrifice. So you need a system that allows both to exist side by side, and a lot of countries do. Hope that answers your question. As far as the specific steps, I mean, they're all legislative. You know, it's in the U.S. Congress has to get rid of their BS politics and understand that access to good medical care is a basic human right. Don't vote Republican, kids. Okay. Sorry to politicize your chat room here. That was a deep question, Fatima. Thank you. Even if it took us a little bit offhand. I think Canada, I think you guys almost are doing it better. You have a very, at least dental-wise, a very healthy private dental sector with a good public dental sector as well. Anytime I do hear this complaint about Canada as well as the British social service, if they become bureaucracies, particularly when they're not well funded, so you have very long wait times and perhaps not the best access to the best of care. But with dentistry, it's easier because it's just there are very basic needs that need to be met. Okay, from Sanika here. Yes, just like what I mentioned from the UK. And NHS is great, but my understanding, NHS also has some very, very long lag times. And that's what we see here in some of the government, like the VA system, which takes care of veterans in the US. They have access to great care, but sometimes with wait times of a year or two, it just makes it not possible. I see veterans who have been waiting for 2 years to get taken care of in the VA hospital, which just give up and they come and see us in private sector. Hopefully, we're moving in the right direction. It's going to be so. Fatima said that there's a lot that we need to do, but we're getting there. Yeah, slowly but surely. I think with the steps that have occurred over the last 8 years, as more people in the U.S. at least have access to better insurance, better health care, I think they're able to put their political views aside and understand that that is necessary. So I think we're slowly inching in there, but we need to make sure that we control that beast and it doesn't become a big wasteful bureaucracy where the government just throws and wastes money at it. So it's very difficult to manage, just like every other aspect of big government is. Okay, I think that I'll put out for the last few questions, but I believe we've reached our time limit. Oh, well, thank you, Valeria. You just made my day. Yeah, I just had a student who's at the University of Florida come shadow us a month ago. He thought he was, his mother set it up for him. He thought he was showing up at a medical surgical office. When he shows up and he realizes we're dentists, he was a little taken aback, maybe a little upset with his mom. And he left saying the exact same thing. Like, I never knew I never even gave one iota of thought to that. And I think most pre-med students who are dead set on, medicine, medical school, I want to be a real doctor, RD as I call them, not a DMD. There's options out there and I think that this fulfills what my profession fulfills, that drive that we all have when looking at healthcare profession at every level. I can check off every item off that list. I get to take care of patients. I get to do fun surgical stuff. I build that trust. I get to fulfill that caretaker role. And, something that now I have a family, I have a wife, I have a young child, allows me to be a provider. That's something that all of you as students, as I was, you're idealistic. You don't think about that side, but you have to. Is it something where I'm going to be able to still have a life on the side, and where am I going to be able to not have to worry about how the rent's going to get paid or where my kid's going to go to school? So you need to take the right steps so you remain a competitive applicant, you go to competitive school, you do well, and you take care of people, but also have the opportunity to thrive professionally in that environment. So thank you, all of you. Again, I will provide. Okay, good. So same ones, but thank you, Valeria. Oh, look at that. Okay, excellent.
Thank you so much for taking time every day to do this. I definitely feel way more informed about dentistry because I had no idea about any of this, but yeah, thank you so much.
Excellent. And anything I can help with, any particular advice? What is the best way to give you my email? Actually, I'll put it in here.
Yeah, we can.
I'm going to put it in the chat right now. If you write to me, it'll be a few days before I get back to you because I get overwhelmed by emails. But that's my email right now. In case anybody wants to reach out with some individual questions. Anybody in the South Florida area wants to visit us and spend some time. My office is currently being remodeled. That's why you see the big white wall behind me. There's usually diplomas and stuff back there. But it's still a cool place to visit, I think.
And we can also post your email on the Google Classroom, but remember to do 5 to 6 sentences on the Google Classroom in order to get your shadowing hours.
Excellent. Thank you all.
Okay, thank you all for being here.
I'm checking out here. Have a good one.
Okay, you too.